Welcome back to Las Vegas. Now, there's been a dramatic increase in colorectal cancer cases among young people. So, Dr. Stephen Yates with Intermountain Healthcare, the sponsors of this next segment, he's here to tell us what we need to know about colorectal health to, prevent this from happening. It's very concerning that this is increasing in young people.
Sure. Colon cancer is the third most common cancer in the U.S. for men and women, and it's the third leading cause of cancer-related deaths. And it's a cancer that can be cured when caught early. So the key is early screening. So for younger patients, and we're seeing now 10% of colon cancer is in patients that are less than age 50.
Wow.
So when we had been thinking, let's screen at age 50, now we're saying let's screen at age 45.
Right. Well, what are the risk factors that people have to consider, when it comes to colorectal cancer? I know, maybe family history. What else?
There are family hereditary cancers. There's something called Lynch syndrome, which puts people at risk for colon cancer.
Okay.
But in general, just getting older, we're more likely to get cancer, and colon cancer is one of those common ones that if we find it early, we're going to be able to survive it.
And what are some of the things that people should look out for physically when, before they get a screening?
So the most common presentation for patients with colon cancer, symptoms-wise, is that the cancer bleeds and they are anemic. So they'll be low on iron, they'll be low on blood, they'll feel fatigued, their legs will feel wobbly, or we call them spaghetti legs sometimes. That's what they may feel. And sometimes they'll notice that they have blood with their bowel movements, and that's a signal that you really should be having it checked out.
Yeah, it is time to go to the doctor at that point.
Unfortunately, it's time to go to the doctor.
But speaking of going to the doctor, let's talk screenings. How is Intermountain Healthcare helping us with that here?
So we have a strong emphasis to do cancer screening. Within our programs, we prefer colonoscopy because it's the best test for screening, but there are other tests that can be done. Something that's called FIT test, which is an immunochemistry test of your stool looking for blood. Also, you can do the genetic test, looking for the genetics of cancer. Cologuard is the company that is advertised on television that does that test. Those are tests that can be done by individuals, and we do support that in our Intermountain program. Okay,
well, Dr. Yates, we appreciate everything that you're doing for us here in the community. You guys make sure you get your screenings. It is so important. Thank you to Intermountain Healthcare for sponsoring this segment. If you have any questions and need more information, just simply visit intermountainhealthcare.org/cancer.